Hi, so now we continue with our second lecture today is flagellates and trypanosomes. Uh, Again, a few more parasites for you to go through. So if you have any questions, feel free to email me and we should start now. Here is a lecture outline. We'll first go through the introductions, then move on to epidemiology, morphology, pathogenesis, clinical manifestations, diagnosis, treatments or managements, and lastly, prevention and control for each disease. First, we look at Leishmaniasis. Leishmaniasis is caused by 20 species of Leishmania. There are so many species to remember. It is transmitted by a bite of sandflies. Sandfly itself also, there are more than 30 species, so many species. Okay, the picture on the right here showing the sandflies, how it looks like. It is almost brown in color, and when it is blood fed, you can see the tummy of the sandflies is actually filled with blood as such. Okay, since there are so many type of leishmaniasis, we actually can divide them into 2 to 3 main types of the disease. Okay, and I say 2 to 3 main types because some literature saying that there are only 2 types of leishmaniasis disease, and there's some that categorize it into 3 types. So the most common types are visceral leishmaniasis and cutaneous leishmaniasis. Visceral leishmaniasis is caused by Leishmania tonanavi, Leishmania infantums, with usually involving the reticular endothelial tissue, liver cells, spleen, bone marrow, and lymph nodes. Alright, for cutaneous leishmaniasis, is involved epithelial cells at the site of the sandfly bites. And then there is the third type, which we categorize as mucocutaneous leishmaniasis. Is caused by Leishmania brasiliensis, which involve the mucous membrane of the mouth and the nose. Okay, we'll look at this one by one later. Worldwide, there are 310 million people are at risk of these infections. 90% of them are from Brazil, Ethiopia, India, Somalia, South Sudan, and Sudan. And it can be further divided into the old leishmaniasis and also newer leishmaniasis. If you look at the classification by species on the right there, uh, the oval involving a few types, Leishmaniasis donovani, infantum, tropicum, Leishmaniasis major, and ethiopica. And in the newer one, it is Brasiliensis, Mexicana complex, and so on. Right? So it's divided in such a way that mainly in the old world, Leishmaniasis is mainly found in Asia, Middle East, Africa, Southern Europe, but in the newer type, it was found in Mexico, Central Africa, America, sorry, and South America. All right. So now we look at the life cycles. It's not very complicated. I just want you to know a few things. In the sandfly, the form that can be found is uh, Brahmasticodes form, which can migrate in the sandflies, and then it will transmit to the human during the feeding. These brommasticodes will actually divided and further divided when it invade the human, and when it invade the macrophage of the human, or it have been phagocytosed, and these chromaticodes will transform into amaticodes and multiply by the simple divisions. So amaticodes form is the one that we usually diagnose under the microscopy in the infected cells. Morphological wise, brommasticodes looks like this. It is a modal form of the parasites. There is a flagella with the symbol F, and the amasticodes is a big dot inside. There's a nucleus and kintoplast. That is features of amasticodes. All right, it is a non-motile form. It is usually can be found in intracellular of the mammalian cells. All right, now we look at visceral leishmaniasis. Commonly, we call them as black fever, dead fever, or dum fever. I'm sure of you know the kala azar as well. Okay, that is the common name for visceral leishmaniasis. So it is the most devastating and fatal form of leishmaniasis. Is caused by Leishmania donovani. 90% occur in Bangladesh, India, Sudan, and Brazil. And each year it causes about 5,000 death cases. And it's very prevalent in India. It's 100 cases per year. And nowadays we found it is called infected with HIV, commonly found infected with HIV because of immunocompromise as well. So VL is also a form of opportunistic infection in these patients. So this is a map showing that the prevalence of VL in Brazil, Sudan, India, and Bangladesh. Here is the pathogenesis. Usually after inoculation by sandflies, the flagellated pneumasticodes will bind to macrophage in the skin. The extent and presentation of the disease depends on several factors, including the humoral and cell-mediated immune response of the host, the virulence of the infecting species, and the parasite burden. Infections may heal spontaneously or may progress to chronic disease, often resulting in death from secondary infection. The incubation period could be from weeks to months or years. Parasitized macrophage disseminate the infection to all parts of the body, but more so to the spleen, liver, and bone marrow. The parasite then multiply in spleen, liver, and lymphocyte, leads to hepatomegaly, lymphadenopathy, and pancytopenia. A combination of deficient clotting factors and thrombocytopenia may lead to severe bleedings. It is fatal after 2 to 3 years if not treated. Cause of death is usually an invasion of a secondary pathogen. In acute cases, patients will also present with chills, fever up to 104 Fahrenheit, and vomiting. It will then progress to complication within several months. Okay, this is the post-Kala Azar thermal leishmaniasis. Okay, it is not another type of leishmaniasis. In fact, it is a recrudescence of visceral leishmaniasis. Okay, usually patients get recrudescence where they didn't complete the treatment, and the parasite somehow suppressed and then reappear again. Okay, so it causes PKDL in short. And in this type of patient, you will see hypopigmented macules, macular papullo or nodular rashes on the face. All right, it mainly happen in student in 50% of the treated VL after about 6 months time. And in India, about 5% to 10% of the treated VL appear again in 2 to 3 years times. Okay, so it is usually triggered by immunological mediated response, right? So cutaneous leishmaniasis is causes disease in about 1.2 million of people. It occur usually in Afghanistan, Brazil, Iran, Peru, Saudi Arabia, and Syria, right? So there are again newborn over cutaneous leishmaniasis, which causes by different species of leishmaniasis. All right. So in this slide here showing that Leishmaniasis tropica, major, and atopica, which is from over in Africa, Middle East, and Southeast Asia, they are transmitted by Pseudopotamus sandflies, and the newer type transmitted by another type of sandflies, which consists of Leishmaniasis mexicana and Braziliensis. This is over cutaneous leishmaniasis in the dry form, wet forms, and in the recurrence forms, which is on the face, and diffuse form is at the back of the patients. Okay, so causes by these 3 species here that I mentioned just now. So it is usually limited to cutaneous tissue only. So sometimes it spread to mucous membrane as well. It first causes lesion first, the sandfly bite causes lesion, and it become reddish and itchy, and then it become an ulcer on the skin, and the lesion will get bigger, and it form surrounding rims on it. Okay, Newer Leishmaniasis is caused by the two species here, Brasiliense and Mexicana complexes. We sometimes call this as mucocutaneous Leishmaniasis. Okay, it usually happens on the nose, on the mouth, which has mucus levels. Okay, how to diagnose the infection? Usually, we can do full blood count. Okay, which the patient will demonstrate the Pachytopenia, okay, is the most common features, and high IgG and high IgM as well, and hyperalbumin, and then when you look at the slide, you can see the MST codes. Okay, look at the right hand picture there. That's how the MST codes look like, with a big dot which is nucleus and also small dot with a kintoplast. All right. So this form of leishmaniasis can be culture as well, and culture can increase the sensitivity to 95%. Okay, we can get the specimen from bone marrow, lymph nodes, or spleen cell. Okay, we can also diagnose by PCR. Of course, can use ELISA, IFAT test, agglutination test, as serological test as well. And there's another special test which is called as a Montenegro skin test, or we call it as a Leishmanian skin test, which can actually look at the delay type hypersensitivity of these infections. Now this is how it looks like. The skin test is very easy. You just do an intradermal injection of a solution which contain the antigen of the primary codes of the Leishmania, and you can see a dot after 48 hours. Okay, usually we measure the size, which is about 5 mm. All right, this is the same test. So treatments of this leishmaniasis, the drug of choice is pentavalent antimony. However, already many drug resistance has been discovered in Europe or India. So now they changed to intravenous liposomal amphotericin B, which is shorter course and lower toxicity. However, it is quite costly. Another type of treatment available, intramuscular pentamidine, which has shown that it can actually cure the infections, but it can also induce diabetes mellitus. Okay, so that's why it's not very suitable. There's one and only oral form of treatment, which is oral menthoxin. It is the only form that can be used in the orally, which already approved by FDA. So treatment of leishmaniasis have to be accompanied by antibiotics as well. Right, don't forget the treatment of the complication like anemia, because they can cause bleeding, right? So have to treat the anemia and also the malnutrition of the patient. How to prevent and control is pretty easy. Of course, we need to have early diagnosis. All right, so early diagnosis can actually help for immediate treatment. All right, so also need to have effective disease surveillance once in a while, of course, especially in endemic areas. So we have to do active surveillance and treat all the active cases. All right, and then we have to have strong partnership with social media, a social group, and strengthening partnership with the ministry. Okay, to help to control the disease. Control the animal reservoir host as well, because this disease is zoonotic. Okay, control the infection in the stray dogs. All right, vector control, SAN5 control are important. It is still very sensitive to insecticide, so control with insecticide is very effective, and also control with using mosquito nets or curtain treated with insecticides is also a way of controlling the disease. There's no vaccine available currently, right? Next, we move on to African trypanosomiasis, which is also Shanghai disease. The infections is caused by Trypanosoma cruzi. So if you look at the image on your right hand side here, this is how the parasites looks like. It is C-shaped. C represent cruzi. This is how we remember the parasites shaped. Yearly
is about 6 to 7 million people are infected, and among them 10,000 deaths. People at risk is about 75 to 90 million. The parasite is transmitted through these trypanosomiasis bites or kissing bugs. So the parasite usually resides in the feces or the poop of the kissing bugs. So the bugs often poop when it bites. It's a funny thing. Then most people get the disease by unknowingly wrapping the trypanosomiasis bite poops into the biting sites and where the parasite enter. This is the life cycles of Chaga disease. So the trypanosomiasis is usually resides the forms in the kissing bugs, and when these kissing bugs bite humans, the parasite will enter the bodies, and trypanosomiasis will then invade the various cells at the wound sites, and they will transform into masticodes and multiplies in the cells, and then they will be divided, and after that it will be released from the cell and it is transformed back into trypanosomiasis before it invades another cells. So the cycle continues. This is how the parasites replicates.
So globally, of course, it is this Chaga disease. It is happened in Latin America. Of course, from there it already spread to the world as well. It spread to Canada, US, Europe, Japan, and also in Australia. All right. So mode of transmission include vector, transplantation, transfusion, congenital, and also oral by contaminated food or drinks. All right.
Infection with Trypanosoma cruzi progresses in 3 consecutive phases. An acute phase, characterized by intense parasitism and blood parasitemia, occurs after parasite transmission. This is then followed by an asymptomatic or intermediate phase in which no clinical symptoms are observed. Most of the individuals in this phase will remain for many years throughout their life. About 20 to 30% of them, however, will develop a chronic phase after a time period ranging from few months to decades, consists of heart complication, and 10 to 20% will develop digestive complications.
Chaga disease is divided into acute phase and chronic phase. During the acute phase, which usually lasts a few weeks or months after infections, the person may not have symptoms or mild symptoms such as fever, headaches, muscle pains, rash, loss of appetites, and some of them have enlarged lymph nodes, and usually you will see swelling at the site of the entry, which is the skin lesions. Sometimes we also call it as a jagomas. And when the lesion is at the eyes, it can cause purplish swellings of the lids of one eye. Usually we call it as the Romano sign. And patient may also have difficulties in breathing and swelling at other sides of the point of entries, abdominal and chest pains. And then if these symptoms prolongs or without treatments, you will go into the chronic phase after 2 months. So the parasites are usually hidden mainly in the heart and the digestive muscles. 30% of these patients suffer from cardiac disorders, and 20% suffer from digestive, neurological, and mixed alterations. In the later years of infections, it can also lead to sudden death due to cardiac arrhythmias or progressive heart failures caused by destruction of the heart muscle and also the nerve systems. Diagnosis can be done by looking at direct examinations in the blood culture. In this case, we call it as a hemocultures, and also we can use xenodiagnosis, where we infect the patient blood with the vector itself, and the parasite we develop in the vector. Of course, we can also diagnose using PCR methods, which is very sensitive. Okay, it's very sensitive to detect it. Serological tests include ELISA again. Okay, can be quite uh, widely used because it's easy to perform, and also have to back up with clinical evaluation, including the medical history, clinical examination, such as ECG, endoscopy, biopsy, or X-ray. Treatment includes benzidazole or nifurtimox. Okay, it is very effective. So far, there's no resistance yet. These two drugs should not be taken by pregnant women. Okay, the treatment of mothers should only be considered after the delivery. Okay, and after the breastfeeding. Okay, it's not safe to take during breastfeeding as well. So at the present, infant and children are prescribed with adult medicine, which can be adjusted according to the weight of the child. Control strategy almost the same. We have to have vector control, fumigate the bugs, okay, destroy the bug in the house or in the surrounding of the house. Transfuse the transfusion control, check the blood before the transfusion. Of course, we have to prevent the mother to child transmission as well. Screening for the mother, the pregnant woman, or diagnosis or treatment for the child, right? Okay, now we come to the last parasite that we're going to talk about for today. So this is sleeping sickness, African trypanosomiasis. Okay, by looking at the name, you know it is prevalent in Africa, okay, right? So this disease is caused by Trypanosoma brucei. It's transmitted by CC flies. I hope you can remember all the flies by now. There are two types of hats, okay, Trypanosoma brucei rhodesiensis, which causes acute infection, which usually can cause death in a week or months. The second one is Trypanosoma brucei cambiense, which causes chronic infection, which can last for years. Okay, it is a severe disease which is fatal if it is not treated. Okay, it causes about 9,000 deaths per year. Over 60 million people are living in the 250 locations at risk of the infection. So this is a very short, simple life cycle. This is the CC flies. In the flies, it is at the trypanosomiasis phase, and then it will become epimasticosis phase again, and also can transform back to trypanosomiasis phase. And this phase can be transmitted to human through the blood to the bite, and in the human, this trypanosomiasis phase will continue, and this is the form that we can see under the microscope, trypanosomiasis phase.
There are two forms of Trypanosoma brucei, depends on the reservoirs. First is cambiensis, the chronic forms, which usually found in humans and caused by human-to-human transmissions, although sometimes it could be found in animals or domestic animals. And for Trypanosoma brucei rhodesiensis, it is the acute forms. The main reservoir is usually cattle. However, other domestic animals can also carry these parasites, such as dogs, pigs, and sheep, and many other game animals harbor this form as well. It can be transmitted to human and cause acute infections.
So this is how the distribution of Africa trypanosomiasis is shown in this slide here. So 37 countries in Sub-Saharan Africa is actually having this infection. So in terms of pathogenesis and clinical manifestation, in the first stage of infection, the patient is at the hemolymphatic stage, where there's a painless chunker ulcer appear on the skin at the site of the bite of the CC flies, and it causes fever, chill, rash, anemia, and weight loss. And if left untreated, it will go on to the stage 2, which is emphylytic stage, where it will invade the central nerve system. The patient will develop headache, mental dullness, apathy, and they feel sleepy all the times. And if left untreated, it will cause the infiltration of the brain and spinal cord and cause neurological degenerations. And final state, it will cause death and it is usually start with coma followed by death of the patient. So this is the progress of the infections. So it started in the blood, go to the lymphatic system, and at the end go to CNS and cause death. So in the chronic infection, which causes by Cambienses, the stage can go from months to years. So it is quite long. Okay, from blood stage to the CNS stage, it is quite long. But for Rondiense, it is quite acute. The whole disease from blood stage to CNS is only from weeks to months, and it causes deaths in a short time if left untreated. So the diagnosis can be done under microscopy. If you look at the picture on your right hand side, that's how the parasite look like. This is a kinky shaped parasite, right? It's very kinky, the purple color parasites. So this form of parasite can be found in expirations, either in the fluid from the chakra or the blood or the lymph system, or sometimes it can be found in CSF finding as well. And this parasite can be cultured in animals. So there's another test that's commonly used, which is cut agglutination assay for trypanosomiasis test. In short, is CATT. All right. So if you look at the bottom right picture, for the positive patient, they will form a positive reaction where you can see many agglutination dots at the positive samples. For the negative one, there's no agglutination at all. Okay. So treatment for early stage depends on the species as well. For Cambienses, so we can treat the patient with pentamidine. For the early stage of Suramine. At the late stage of Cambiense infection, you can treat the patient with ifronidine and sometimes ifronidine plus nifurtimox or melarsoprol. Okay. For rhodesiensis infections, early stage can be treated with Suramine, and the late stage has to be treated with melarsoprol. Prevention and control, almost the same approach. Ways to active surveillance, look for the cases actively and treat them very fast. Vector control, we reduce the CC flies. Okay, look for the breeding sites, use insecticides, or use traps or screen that can prevent the bugs from getting into the house. All these have to involve community participation as well. Okay. Okay, that's the end of the class for today. Thank you for your attention. It's a long day for you. Bye.
In the last few slides, I have summarized what I have mentioned before this on Leishmaniasis, about the definitions, mode of transmission, clinical manifestations, followed by the pathogenesis and clinical features, diagnosis, treatments, and prevention and controls. Here is the summary of American trypanosomiasis on the definitions, mode of transmission, clinical manifestations, pathogenesis, diagnosis, treatments, prevention and control. And the last slide on sleeping sickness. So read through this during your free time. All the best.